I'm an internal medicine doctor, and my dreams in getting involved in genomics were that we could do something more effective in terms of preventing disease and treating it when it happens. And that is my dream for what genomics can offer us, and it's starting to come true. We are all now at the position, if we're interested and willing to look at it, to find out what our risks are for a long list of common diseases. That, combined with our family medical history, if we have access to that, can provide an opportunity to practice prevention in an individualized way instead of one size fits all, which hasn't worked as well as we would like. More than that, if you happen to fall through the safety net and get sick anyway, despite your best efforts at prevention, what's going to be waiting for you, and already is for a number of diseases, are treatments that are based on a full molecular understanding of the disease instead of sort of good guesses. We've had good guesses, and sometimes that's better than nothing, but we can do better now. So both the diagnostics and the preventions and the therapeutics in medicine are going to be radically different in the next 10 or 15 years, building on this foundation that we now have in front of us.
The willingness to step forward, have your DNA read, the price point is coming down to make that happen. It's accessible to us.
Yes.
What would you say to GQ readers about this whole dynamic of dare to know your genes?
Well, I think it's an important thing for everyone to look at. Now, I'm just finishing a book on personalized medicine, trying to lay out what the science is here to give people a chance to get a sense of whether they want to know this information just now or whether they want to wait a while. I think there is some empowerment possible here, and in that book I'll tell a lot of stories of people who've already had that experience. It's going to get better and stronger because we are still just beginning to scratch the surface of the power of this kind of predictability that one can get from DNA. It's better for some diseases than others. People, though, need to be thoughtful about their own reaction to this. Nobody should rush into it. Nobody should just say, oh, it's a recreational kind of thing. It's powerful information. It's about yourself. It has implications for your family, but it can empower you to stay healthy. And that is, I think, the message that people are interested in hearing.
Let's stay with that empowerment. The ability, we used to be able to say, oh, I'm worried about it because it runs in my family, and you just stay worried.
Right.
The ability to now know with just a bit more specificity, well, there is a predisposition.
Yes.
How does that energize people? Do they want to be first for clinical trials? What are we looking for with that empowerment?
Sure. Well, it depends on the condition and the degree to which various steps are already available to reduce your risk. So if you find you're at risk for cancer, for instance, and it's the kind of cancer for which a screening test is available, like a PSA test if you're a man for prostate cancer or a mammogram if you're a woman for breast cancer, this is an opportunity to practice better prevention based on your risk, which is maybe a little higher. So maybe your use of those screening facilities ought to be a little more aggressively organized, start a little sooner, do them a little often. If it's a condition for which we don't yet have an intervention, then it's still potentially valuable to know the information because you can plan, you can think about how you want to organize your life accordingly. It very much, though, becomes a bit of a personal thing. There are people who are searchers for information, and there are people who say, I don't think I want to know. Let me just kind of go on the way I am. I'm afraid that information would be a cloud over my head. And everybody's got to sort of take their own temperature and see where they are. But the more we offer people information that's actionable, where you can do something, the more people are going to come over to the side of saying, okay, it's time, I want to know.
Now, there are very famous scientists like yourselves who have had their genome done. Have you had your genome done?
I haven't yet, but I'm contemplating it quite seriously.
All right, those who had, like Watson, had his genome done, did not want to know whether he had the gene for Alzheimer's.
Yes.
Many scientists, what is the angst around a disease that eventually erases the mind? What do you think is the gestalt around that?
Well, I think all of us contemplating the possibility of that kind of disorder are fearful of what that would mean for ourselves, for our loved ones. Maybe for a scientist, it's particularly a fearful outcome because scientists depend upon their intellect and their brain to be able to do what they do in their profession. And so if there's an occasion where maybe we want to hide our heads in the sand, Alzheimer's might be somewhat in that category. I think the other thing that has an impact here is the general sense that at the moment, knowing that you have that E4 version of the ApoE gene, does not allow you to do something to prevent the outcome. It allows you to know that your risk is higher. The day that we come up with a well-validated intervention so that knowing you're at risk at age 35 allows you to do something to reduce that risk, then Jim Watson and everybody else will say, tell me, I want to know. I want to be able to take advantage of that. And people are working very hard on providing that kind of intervention opportunity, and I think we'll get there.
Since you've been looking at personalized medicine, the issue of people knowing they're predisposed, do they become activists? Do they pay attention? Is this the opportunity for behavior modification that doctors have said, I don't know, we tell them everything and they just still don't behave?
Yeah, I think it is, actually. I think that's a very good point. That some people who are cynical about DNA testing say, you know, you go through those tests and what do you get? Recommendations about watch your diet, don't gain weight, do your exercises, and so on. We should all be doing that. Don't smoke. But it is very hard sometimes for people to hear that and to feel that it's relevant to them. And this moment of finding out your individual risks in many people's minds becomes a teachable moment. It's sort of the light goes on. Oh, I'm not a perfect specimen, because there aren't any, by the way. Oh, I have these glitches in my DNA. Oh, I might not live forever. I might not get even close to that if I don't take care of myself. Okay, now I'm motivated. Now I'm going to do something. Maybe they should have before, but the behavioral change seems to be specifically encouraged in many people by having this individual information.